Any other questions to Alistair? Is there a question? I can't read here. Is there a question there? Can you read it out, please?
How do you deal with all the ethical aspects of uterus transplantation, pregnancy, and transplanted uterus from a living donor or a persistent vegetative donor?
This is for Jeff Chapa.
Well, so at the Cleveland Clinic, we don't do the living donor. We only do a deceased donor transplant, so we don't have to handle the ethical issues with the, and that's the reason we worry about the morbidity to a living donor with the procedure.
So the question is, if one of the ladies wants to give up her uterus consciously, like a living-related liver transplant, which happens now, would that be something that is foreseeable? With a living donor. So there are programs. Yeah, she wants to donate the uterus to a living related. I mean, that's been done. It's just not the protocol that we have here. Okay. There are places that do that. And that's the whole debate. Is it a living donor or a deceased donor program? We chose to do the deceased donor program for that reason.
Probably worth clarifying, because he specifically said persistently vegetative, and that would not be a candidate for organ donor.
Yeah, I don't think so either. Brain, yeah.
And so you have to be defined as brain dead. So no, we don't do anything in the U.S. with persistently vegetative.
Correct.
Thank you. I didn't catch that.
Well, that's great. It's 5:15. I'd like to invite Dr. Aziz to come and, oh, okay. Go ahead.
Okay, there's another question from Sharon Abraham. I haven't heard any mention of the value of 3D echo in the talks. Does the Cleveland Clinic utilize 3D echo in surgical and treatment planning?
Fran.
Yes, so I think that we didn't necessarily discuss it since this was focused on some of the fetuses and maybe just some other talks, but we do use 3D echo in some of our TEEs in the older patients who can accept the probes that can do it, and sometimes in our surgical and otherwise planning. So I think that we try to utilize multimodality imaging, whether it's 3D echo or MRI or a CT scan, and just figure out what's the best imaging modality or combination thereof to figure out what's going on with the patients.